The first question has to do with testing capacity. I mean, the good thing is the requirements for testing were loosened. So if you have the symptoms, you can get a test. What is San Antonio's testing capacity, and what is the turnaround time like getting results?
So, we have been lucky compared to a lot of cities in the United States because we've had the capacity to do an additional 3,500 tests per week funded by the federal government. That's the testing that's available for free down at the Freeman Coliseum. The turnaround time has been slow. The turnaround time is quoted as being 4 to 5 days. It could be even longer. And that particular 3,500 tests a week capacity that we were given will only be up until the 10th of April. But in the meantime, a lot of our private labs have come on board, and there are a number of places where you can get tested now, including at UT Health, of course, Texas Med Clinic. And the turnaround time, though, is still slow for most people. We're quoted 4 to 5 days. I sent a patient for testing on April 1st, and I am still waiting for the commercial lab to give me that test result. Today is April 7th, and both the patient and I are very eager and very concerned about that test result. Now, I want to tell you that at University Hospital, we have a variety of different kinds of tests for COVID that are available thanks to the efforts of our incredible laboratory personnel. And we actually can get about 130 tests a day done. I think that's roughly our capacity in the hospital. And we can get a 24-hour turnaround.
Wow.
However, that 24-hour turnaround is reserved for special people, the sickest people in the hospital, as you might imagine. We really need to know quickly if a patient in the hospital has COVID-19 or not, because we've got to segregate them, isolate them from the other sick people in the hospital. And the other group that are prioritized for this more rapid turnaround and test are, of course, the healthcare workers. Because if we don't know if their fever is due to COVID, then they're out for a long time, and we start to deplete our healthcare workforce. If we can test them and find out that they're negative, then we can get them back to work and on duty much more quickly. So we do have this capacity for 24-hour turnaround, but it is focused on the sickest people, the hospitalized people, and the healthcare workers. And this is going to change, Steve. It's going to get better. We really believe it's going to get better, and that's because there are multiple different kinds of tests that are available and that are coming online. We'll still be limited by shortages of reagents, because we have to share, across the country, but we are making progress, and the turnaround time is going to get better.